Pharmacists say they're glad to be part of a groundbreaking change within the health system. The majority of pharmacies across the country have now signed up to and received training for the Common Conditions Service. The service allows pharmacists to prescribe treatments for 8 minor illnesses, including urinary tract infections, thrush and shingles. 94% of pharmacies across the country have now signed up. Tom Murray is president of the Irish Pharmacy Union. He says there are multiple benefits.
Number one, it is to relieve pressure on the primary healthcare system and increase accessibility for patients. And number two is to recognise the clinical skills of pharmacists. So we've been calling for this service for years, but it is a groundbreaking change. Over 90% of people live within 5 kilometres of a pharmacy, and roughly half the population visits a pharmacy every month. So pharmacists are incredibly accessible.
President of the Irish Pharmacy Union, Tom Murray, there speaking about this. I've also been chatting about the Common Conditions Service with the Shannon-based pharmacist, Feidhlim Hillary. Feidhlim, thanks for joining us on Morning Focus.
Hello, Alan. How are you today?
Very well, and keen, as I'm sure our listeners are, to find out more about the Common Conditions Service. It's being described as a groundbreaking development for the health system. Why so?
Yeah, well, I suppose, look, this is something, as pharmacists, we've been kind of seeking from the Department of Health and the HSE and the Minister for quite a number of years now. It's already been rolled out a number of other jurisdictions around Europe and that to much success. So basically what it boils down to in a nutshell is there's 8 conditions that pharmacists will be allowed to dispense prescription medicines without a GP's prescription. Now, these would be ones, I suppose, that we would see in the pharmacy on a regular basis. And even though we know what the patient needs or what needs to be prescribed or dispensed, because of the current legislation, obviously, we are not in a position to be able to do that. Only a doctor can prescribe medicines at the moment, prescription-only medicines at the moment. So it'll allow us to have that, give that opportunity to be able to give patients certain medicines. Now, at the moment, there's only a list of 8, and we still have to kind of find out exactly how this is going to be rolled out and when we're going to be able to do it, etc. But it'll just make life a little bit easier, I suppose, on the patients, that they can come into us with some of these common conditions. We'll be able to give them a medicine rather than saying to them, I'm afraid you have to go to your GP. It'll also ease the pressure on the GPs and on the emergency departments, but especially the GPs, the local GPs, that at least we can kind of give the patient something to start them off, see how they get on. Obviously, if what we give them doesn't solve the problem, then we would very strongly be kind of recommending to them, you do need to see a GP or a doctor now at this stage.
Okay.
But it should ease the pressure on the already overwhelmed kind of GP surgeries in County Clare.
And I know from speaking to GPs on the show about that pressure that they're under, they will undoubtedly welcome this. I mentioned at the outset some of the illnesses you'll be able to diagnose and prescribe for, the likes of urinary tract infections, thrush or shingles. What other kind of conditions are we talking about, Feidhlim? And for a patient who may be dealing with these conditions, you know, how will this change their experience, aside from, I suppose, expediency of getting a solution to it? Or,
well, I suppose that's it in a nutshell, Alan. You know, I mean, if a patient has a UTI, a urinary tract infection, you know, it's quite uncomfortable. You know, if they ring up their GP, sometimes they have to wait 2 or 3 days before a GP will be in a position to be able to kind of to issue a prescription for them. So at least if they're able to kind of come into a pharmacy and they have the symptoms that we'll be able to recommend them taking, you know, an antibiotic, it speeds up the process. You know, it starts it off. All antibiotics can take 24 to 48 hours before they start having any effect. So, you know, I suppose it's the difference between taking it on day 1 or taking it on day 3. So it should speed it up for the patient, and, you know, they'll be in a better position to kind of be able to kind of, you know, get on with their everyday lives. God knows we're all kind of running and racing and trying to kind of get 100 things done at the same time. So that's the whole point of it, is kind of make sure that the patient, A, gets the correct medicine for what the symptoms are, B, speeds up the process, C, take the pressure off the GPs, and like that. If a patient, if what we prescribe or what we dispense doesn't solve the problem, then they will kind of very strongly be kind of recommended to go to their GP then at that stage to get kind of further treatment.
The fact that 94% of pharmacies have apparently signed up for this, what does that tell us about how the profession views this change?
Well, like I said at the beginning, this is something that, as pharmacists, we've been kind of talking about with the Department of Health and with the Minister through our union, the Irish Pharmacy Union, for quite a number of years. And as I said, it has been rolled out very successfully, in the UK and in some of the countries in Europe, some of our neighbours in Europe, and to great success, and it doesn't seem to have been kind of a scheme that's kind of abused is the wrong word to use, but it seems to be successful in the sense that it does what it sets out to do, is to treat the patient and not kind of cause further problems by if the wrong medicine, or if a patient kind of kept getting the same medication repeatedly and it led to something else. It seems to have kind of been very successful in treating these what we would call common conditions. Not so much minor conditions, because all conditions kind of there be a certain degree of severity to them, and I suppose if you're the patient who's suffering from them, it's quite debilitating for you at that time. So it has been successful, like I said, and that's why we've been looking for it, and it's kind of no surprise to us that there was such a high take up by my colleagues around the country, kind of, to get on board, to be in a position to be able to provide this service to their customers and patients going forward.
And it's not just GPs, I'm sure, who will welcome this. Primary care services as well, who you would hope would feel the pressure reduced on the need of people to avail of their services.
Absolutely. I mean, it's just I suppose, we're all on the same team in the kind of the healthcare profession, and I suppose if our cog kind of helps another cog move more freely or swiftly, and kind of frees up the time to be able to deal with more complicated or complex conditions or situations, then it's a win-win for everybody.
Will it need any sort of additional training from pharmacists in order to deliver this service safely? Some listeners listening now might wonder, is it safe for pharmacists to diagnose these conditions? But I would imagine these are conditions pharmacists will be very familiar with. Absolutely.
And I mean, it's a very good question, and it has actually been put to me, by a patient of mine who kind of was aware that this has been rolled out, Yes, there will be training. We are going to be undergoing training. We haven't found out exactly what yet, but we know that there is training coming down the line in relation to it. So we will be in a better position than we are at the moment to be able to kind of, work out the symptoms that a patient is telling us, so we're able to kind of see if it is something that we can treat or if it is something that we need to refer them back to a GP or a doctor in relation to. Now, as I said, 90% of the time a patient will come in with one of these conditions. We know exactly what the doctor is going to prescribe, but unfortunately we're not in a position to be able to give that medicine out without a valid prescription. So it's kind of, we are going to be trained. That is going to happen. We are going to be in a better position to be able to kind of deal and treat these conditions. But I suppose our experience, we already have that, or an awful lot of that experience and training built up over the number of years that we have been practicing.
And aside from the illnesses I mentioned, UTI, thrush, shingles, we're talking about the likes of cold sores, conjunctivitis, impetigo, vulvo-vaginal thrush and allergic rhinitis.
Yeah. So, look at, every couple of days every pharmacy in the country, probably every day, you'll have a patient coming in with one, if not more, than those conditions. You'll have patients with minor eye infections, or they'll have severe hay fever. So at least we'll be in a better position to be able to say, okay, we'll kind of, we can give you something stronger now than what we were able to give before. We might be able to give them a mild antibiotic that will treat the eye infection, or a better steroid nasal spray. Like I said, I'm not 100% sure how far this is going to allow us to dispense to the patient, but it will be better than what we're able to give them at the moment. We'll be able to give them stronger than over-the-counter medications.
And just finally, Feidhlim, as far you have already said you're not sure when exactly the public can start to see the service available in their local pharmacies. No doubt they'd want to see it as soon as possible. For those patients availing of the service, there will be, understand, a consultation fee, although medicines covered under the existing HC community drug schemes, the likes of medical cards or the drugs payment scheme, they'll be charged in line with current eligibility rules. Is that your understanding?
That is my understanding. And your guess is as good as mine at this stage, I'm afraid, Alan. But I would assume that a medical card patient will be still able to avail of it under the medical card scheme, the drug payment scheme. Likewise, that patients on the community health care schemes this will kind of be covered under their existing kind of card, whichever one that they hold. I would assume. But like I said, we're still waiting kind of for clarification in relation to all of these. And we're hoping that this is, when we signed up for it back in September, October, we were under the understanding that this would be rolled out in the first couple of months of the new year. So we're hoping, hopefully by Easter, this will be something that will be in most pharmacies, that will be in a position to be able to provide this extra service.
Hopefully by then it will be up and running. The Shannon-based pharmacist Feidhlim Hillary, thanks as ever for joining me on Morning Focus.
Thank you, Alan.